of professionals that are here to talk about disparities in communities of color during COVID-19. So with that being said, I am going to first begin by introducing the panelists here. Excuse me. First, we have Reverend Dr. Denise Lawrence, and she is the Pastoral Care Coordinator for MJHS, also an Associate Minister at the Greater Allen Cathedral of New York. We also are joined by Lanice Watson Hudson, who is the Director of Nursing at the Joseph Piedabo Family Health Center, as well as Joylyn Primus Armstrong, who is a certified registered nurse, as well as an anesthetist. Did I pronounce it correctly? Anesthetist. And she is with Envision Healthcare. And we are waiting to have join us Elias Humusdian. I keep tripping on his last name, but he is the president of the Correction Officers Benevolent Association, and he'll be joining us shortly as well. So we, for right now, just to kind of do a little housekeeping, have placed everyone on mute until the Q&A piece. So if you have questions, feel free to drop your questions in the chat box. They will be monitored by Ms. Chantel Johnson, who is assisting and really kind of orchestrating everything behind the scenes right now. And so we will open it up so people can ask questions directly also, but we don't want you to forget those questions. So if you have a pressing question, definitely put it in the chat box. With that being said, we will start by having each of the panelists introduce themselves, just give us a little snapshot of the work that they do and how it's been impacted by the current pandemic. So with that being said, we'll start with Reverend Dr. Denise Lawrence.
All right, good evening, everyone. Selvena, I want to commend you and thank you for having this discussion tonight. It's a very, very important discussion, particularly in our community. I serve as the Pastoral Care Coordinator for MJHS, which is one of the premier hospice programs in the New York City area. We're in all areas except for Staten Island and Suffolk County. And I am primarily responsible for Nassau County. So I work as far south as Long Beach, which is where I came from today, as far north as Port Washington, and go to the Suffolk County line and to the Queens line. We have 900 patients, so we have about, on my roster, I have about 100 patients that are 67 patients that are rotated. I work with an interdisciplinary group of the nurses, the doctors, and the social workers, and primarily preparing families for end of life. It's an honor to be able to walk with patients at that particular time, and we work with patients across all religious backgrounds, non-religious. I work primarily with the Protestant and Catholic Christian patients, and our rabbis work with the Jewish patients. So this has been a time that has personally impacted me in terms of coronavirus. I was actually infected at the end of March. So this is actually my second week back. So it was interesting to begin almost at the height of the epidemic here in New York, and then coming back at a certain level of flattening. We had a little discussion earlier before we began, and I think it's going to be apropos as we look at the next couple of weeks coming. People not really taking this serious, not doing safe distancing, not putting on masks, and there's anything that I want to be able to push for this discussion tonight, particularly our community, where we're representing only 13% of the United States population, and we are becoming 40 and 50% of the fatalities as it relates to coronavirus. Thank you.
Thank you so much. And next we will go to Lanice.
Oh, good evening, everyone. I hope everyone is well on this Friday evening. It was a beautiful day today, and I appreciate seeing faces that are not behind masks. I love the lipstick and everything. And gentlemen, I'm loving not having to wear that mask because I'm starting to get war stores like everyone else as a result of it. But my name is Lanice Watson Hudson. I'm the Director of Nursing at the Joseph P. Adabo Family Health Care Center. We are a federally qualified health center, which is basically a community health center that offers health care to persons irrespective to their ability to pay. I oversee nursing operations in 6 clinics, Brooklyn, Queens, and we have a clinic in Red Hook, Brooklyn. So I'm thankful that Soror Selvena, that you invited me here tonight so I can share knowledge with everyone and bring some more light to the reason why our communities are so affected and devastated by this virus. So thank you so much for having me.
Thank you so much. And next we will hear from Joylyn.
Good evening, everybody. My name is Joylyn Primus Armstrong, and I'm a certified registered nurse anesthetist. My job is to provide anesthesia care to patients wherever it is necessary, primarily in the operating room and other areas like where patients are needed to have my skills and my ability to make sure they're comfortable during procedures. But my background is really pediatric anesthesia. So because of COVID, I was pulled out of my familiarity with children and had to work more with adult patients. And anesthesia people, we are known as your IV and your airway specialist. So right away, we became the intubation team. And with us becoming intubation teams, the hospitals themselves, both anesthesia departments and surgical departments, suffered because we could only do emergency cases and emergent cases because most of our hospitals were occupied by COVID-19 patients. So we didn't have any areas to recover patients that were well patients that were coming in for surgery. So you could say the majority of us took a hit in salary also. Some of us between 30 to 50%. I was used to working a 2 to a 3 day week. I went to work 6 to 7 days a week. Sometimes coming home and sitting on a bench and sometimes could be called back into work. But, you know, this is what I'm here for. And I really want to help my people. So, you know, our specialty is needed. You know, also the state of New York, I'm what they call an advanced nurse practitioner. I usually have to work under the guidance of a doctor, but because of COVID-19, we are now independent practitioners making decisions on our own. And thank God I've been an anesthetist for over 25 years, so I'm able to handle, you know, but it is really, really being an emotional thing for me, more so because I know when I see these patients, hopefully you always think that you can help people, but this is a position where we don't know what's going to happen. And like, am I helping this person? Or because we really don't have any guidelines. You know, this is something that came up on us. And when it came up, the country was not prepared. And we didn't think that COVID was going to be as bad as it is, you know. And my main concern was coming home. My children are home from school. I have 3 college students and I social distance myself from my children. I come home, I strip at the door, I wash my clothes and I go upstairs, you know, they might bring me food and it's left outside the door, you know, and we still practice social distancing here in this household, you know, but I'm happy to help. And I'm just hoping that we have better guidelines to follow in case we get a second wave.
Thank you so much for that and for sharing that perspective. I know we have been now joined by Elias, once again, who's the president of the Correction Officers Benevolent Association. Thank you so much for joining us this evening. We appreciate it. We know how busy you are, just like all of the other panelists, so definitely value your time for being here. So just to bring you up to speed, we're on the first question. So the one that I asked is, please introduce yourself and tell us a little bit about your work and how it's been impacted through the pandemic.
Okay, Elias Hussamuddin. I'm the president of the Correction Officers Benevolent Association. I represent New York City Correction Officers, active and retired, which covers Rikers Island, the borough facilities, Bellevue Hospital, things, and those type of places. Of course, I think it's probably fair to say that I've been raising a lot of hell as far as correction officers are concerned, as far as PPEs and things of that nature is concerned. I mean, representing New York correction officers, we actually literally had to go to court in order to force the Department of Corrections to provide correction officers with N95 masks and gloves and hand sanitizers. And without waiting for them, we actually purchased it for our members ourselves. We went out and purchased 40,000 masks. The department, the city of New York, has been slow, behind. I know a lot of people got caught off guard with this thing, but even afterwards, you would think that they would be able to catch up. One of the things, and you let me know as far as the time is concerned, because I will talk until somebody stop me. One of the things that we asked for was a task force. We asked our Commissioner of Corrections to create a task force, a COVID-19 task force, which, her response was she didn't have the resources or the staffing to do it. And Rikers Island, the catchword is, what is it, epidemic? We are in the middle of this thing with a very controlled, contained population of people. And if anybody needed to have PPEs next to the nurses, I think we're one of the only ones that's actually stuck with a group of people where we could not telecommunicate. We could not work from home. We didn't have that privilege or that ability to do that. We literally have to come in and take care of the inmates, detainees, incarcerated person. I don't know what the political correct thing is here, but the people in our custody, we actually had to fight even for them to get masks, for them to have, the inmates to have masks, to have gloves and sanitizer. So, and just moving forward right now, I've just was asked to be on the committee by the mayor for reopening in the city. And, I've sit on the committee for labor, and one of the things I had to remind them was corrections never close. We're talking about reopening the city. We never closed. We were still here. And now I'm trying, being on this panel, I'm trying to be proactive, because eventually we're going to have to let these people go out to yard for outside recreation. They haven't been out in months. They haven't had any visitors. Everything has been reduced, and they're not even prepared. They don't even have a program or plan moving forward. And, unfortunately, my agency is a very reactive type of agency. But here I am, the president of the union, representing correction officers, saying we have to get ahead of this. I mean, one other area that people might not even want to talk about, like I explained to them, we even have to prepare for the uptick that we're going to experience in people going to jail, because people are going to be going to jail. Once this thing is over and, no one has jobs, no summer jobs, we're going to have a problem. So, it's a lot of things that's going on in trying to prepare for the COVID-19. They're saying that it could come back and it could be worse. Rikers Island, we have a lot of work to do. You guys want me to go on?
No, thank you for sharing. We have other questions for you, but thank you for sharing that perspective, because that's very real, especially, as you said, being in a space where you are over the custody of individuals that are in your care as well. So it's very good to hear that you're not only advocating for your members, but also for that population as well. And so it just shows like how many levels it is to this, how impacted folks are. So thank you for sharing that perspective. And I'm so glad that you are on that panel. And look forward to the great work that comes out of there prayerfully. So the next one, initially, there was like a lot going on in social media where people were saying Black people don't get coronavirus. And initially, you know, it was all games and folks thought, you know, only white people got it, right? And then all of a sudden we started seeing a surge happening in our community. So I just wanted from a medical perspective to understand why has it disproportionately hit our community in the way that it did. So I want to push that question to Joylyn and to Lanice from a medical perspective.
Okay, Joylyn?
Okay, well, because of our lifestyles and we're always busy. We're always too busy. We're too busy to take care of ourselves. Me, myself, guilty for that. Self-care, taking time to cook right, exercise, enjoy the fresh air. And also with us as a people, comorbidity, those comorbidity diseases, we inherited them, right? So that's why we should take time to look after ourselves in order to prevent. Because what started happening with COVID-19, you had some people whose bodies were more in tune, who were able to fight off the virus. Their immunity systems were more elevated and they were able to fight off. And then those of us who had asthma and all other underlying diseases, we were having issues. And also, you know, with us as a people, we can't only blame the people, because Black people, and not only Black people, minority people, period. We're living in areas like where it is crowded. When you are in an area where it is crowded, you spread disease. You have people living in buildings, they're taking stairs, holding the railing. They're going into buildings, pressing the doorbell. They are taking elevators. So when you go into your homes, you gotta wash your hands. You have to take some type of precautionary measure. Lord knows who was in that building, who was carrying diseases, not wearing masks, you know, and then we come back again to where they told us to treat this thing as the flu, right? And this was coming from people that were in charge of infectious disease in a hospital setting, told us to treat this like the flu, because nobody knew. This was early, like late February, and we knew that this thing was coming, but we didn't think that it was going to be this bad, and we didn't think that it was going to be that contagious, because we thought it was just like another strain of the flu. But behold, you know, it just was not another strain of the flu. And the way how Black patients are treated, Black people, if you go to some place and you said that you want a test, you know, want a COVID test. Oh, do you have any symptoms? No, but I think I need to be tested. I don't think people should be turned away from testing. Me, myself, I went for a test, and, you know, all these questions, I said, I can't get a test. You know, I said, I work with patients, you know, and where I'm really working with the patient's airways, and I like to get a test. I don't have symptoms, but I would like my job to know if I'm infected. And I would like my family to know if I'm infected, so I know how to take precautions. But, you know, it's like people of color are treated very differently. You know, I know a doctor himself, well, you guys are going to get to meet him next week if you guys are in tune. He wasn't feeling well, and he stayed at home. He called the ambulance, and they were reluctant to take him. He said, you better take me, I'm a doctor. And he had his oximeter reader that showed that his oxygen percentage was down, and they took him. You know, so thank God we were able to stand up, and we know how to speak to these people, but we have people in our community that won't be able to handle that situation. So they send them home. Oh, we can't help you. You don't have any symptoms. So these people go home. So when they go home, more than 50% of them are positive. So they're spreading it in the household. They go to the store, they're not feeling any symptoms. They said, I have a little headache, you know, and they don't even have the fever. So they continue to go to the store. They're spreading it to people in the neighborhood. You know, so that's why this virus is uncontrollable in our settings. We are in crowded conditions. We're taking the MTA. You know, we're taking buses, we're taking trains. How could you control the spread of disease in the train? Are we going to be doing a head count to see how many people get on a train? And if that's the case, how many trains did you have to run? And what kind of schedule would you have to run? So, you know, all these things we have to start thinking about. Our communities are crowded. They are crowded. We do not have the healthcare and resources that you have. I live up in the suburbs. I get CVS almost every other block. We don't have that in the city, in the inner city areas. We don't have that. So our people are deprived. The food that they sell us in the stores is very different. It's very different because I myself, I love my cultural food. And if I need my cultural food, I'm not going to get in my neighborhood. I have to go to the neighborhood to get my food. So it's like we are treated completely different. So our resources are different. And a lot of the choices that they have for us is not always healthy choices. You know, so I think also with the closing of the churches, the closing of the barbershops and other areas where we as people tend to gather, where we look up to people that are, you know, that handle responsibilities, who we see as our leadership. A lot of people are not getting this, but we are not supposed to gather. So since we're not supposed to gather, a lot of people are not educated if they're not looking at the news, if they don't have a television set, if they don't have a computer. So then again, this also helped with the spread.
Well, thank you for that perspective. And now we'll hear from Venice.
Okay, well, Joy just took everything right out of my mouth, so I'm just gonna piggyback off of her. But she brought forth a lot of valid truth. People of color, Latino communities, African American communities, where we are just up on each other. If there's someone, we have to go out into the workforce. So a lot of our folks that live in communities that are underserved are folks that work in MTA, folks that work at McDonald's, at the supermarkets, socioeconomic status. The lower the economic status, the higher the medical acuity. It's a known. We didn't need this pandemic to tell us and show us that there are health inequities. That's a known fact, and we're not going to get the health care that we need. It greatly saddens me regarding PPE. I'm going to share with you, in the Rockaways, we have two facilities, one on Central Avenue and the other in Arverne. There's one hospital in that community that serves a large population of people, and that's St. John's Hospital. As a result of COVID and the amount of healthcare workers that they needed, they had to condense their workforce and able to enhance their services to those persons with COVID. Secondary, they had to close outpatient clinics. Now, closing those outpatient clinics and having us in those communities as a FQHC and being able to give health care to people regardless to their ability to pay. So if you're closing your outpatient clinics, where are people gonna go? They had nowhere to go but to us. Now we're supposed to be partners. So PPE was a big challenge for us. This thing came, COVID came like a thief in the night. We did not expect anything as enormous as this monster. Our PPE depleted quickly. We've had to make masks, depend on donations. Unfortunately, government agencies did not see us as a priority. We did not equate to those other healthcare facilities in other communities that were considered to be priority because we were not a hospital setting. But we are the type of facility that partners with the hospital settings to treat people, to try to decrease the amount of people that are going to these hospital settings. Who wants to go to the hospital nowadays? No one wants to go to the emergency room. I don't care if you're at home and you have a fever, you're afraid to go because the stereotype now is once you go into a hospital, you're not coming out. Unfortunately, we lost one of our great doctors, Dr. Chen, who worked out of the Arvern office for many years. He was such a humanitarian. He cared for generations of people. He unfortunately died doing what he loved best. Unfortunately, healthcare workers were not prepared for this. And as a result of this, many of us have gotten sick. Many of us have presented with symptoms. Many of us have not presented with symptoms. The CDC, I think that they were not totally transparent with us from the beginning. So in lieu of that, we didn't really know what to do. We had to depend on our own medical providers. I work under a phenomenal chief medical officer. She is phenomenal, very smart. She had to think, okay, what is it that we're going to do and how are we going to do it? And we need to do something now. The healthcare needs, it just exceeded the amount of providers that we had. People are afraid. No one wanted to come to work. First thing she thought about, let's initiate telehealth. Telehealth gave us a platform that we can still provide healthcare services to people in their homes. No one wanted to come out. And through telehealth, we were able to monitor people, prescribe to people, and if you had a need where you needed to come into the healthcare center, we were available for you to do that as well. Although PPE was compromised, we made a way. There were a couple of days that I had to work out of a hefty trash bag, and I rocked that trash bag. Long as I had my N95 on, I had to do what I had to do. We serve a community of amazing people. Unfortunately, those amazing people have had to suffer for years because they are in underserved communities. It is just outrageous, and it just disgusts me because of the healthcare inequities. Back to St. John's Hospital. Now, this is a hospital who had solicited for donations. They received a huge donation of PPE. I worked with a woman there who I considered a friend. I asked her for 100 gowns. Now, if you've gotten thousands, can you give us at least 100 to hold us over until we can get our PPE? As the borders, the Asian borders, those are the ones that are now manufacturing all the PPE, they're holding up purchased items. So all of the deliveries are delayed. They wouldn't even give us 100 gowns to help serve a population of people that we collectively serve together. And this is what upset me so much. Selvena, you've heard my story. You've heard me cry. I continue to try to be proactive. I'm out there on the front line. We've implemented a COVID testing center out of a tent. A lot of people thought that, oh my God, what's the matter with them? They're in a tent. Our tent was flying all over the place, but we were still there serving community. There were people, Joy, I hear what you said, that you had to be symptomatic in order for someone to give you a test. We'll give you a test, just come on out. We did walk-ins, we did appointments, because we knew if we didn't provide services to our community, who would? So it's just so unfortunate that a community that has been underserved, a community that has been neglected, continues to have to struggle because of healthcare inequities. In addition to that, the disparities, the comorbidities. We've got, I mean, we're like doomed for failure. So, you know, we have to help each other. Each one teach one, each one help one. We have to be available to provide resources. We have to be available to help people, and teaching is so essential, especially now. There's an imminent need for people to know, wash your hands. 20 seconds. Sing happy birthday, not the Stevie Wonder version, the regular version. And you know, some people don't know how to properly wash hands. Young people, you see them on the corners, smoking marijuana, sharing things. What are they doing? They're spreading disease, they're spreading sickness, they're spreading infection. So our communities are in dire need of training and education, and it's up to us to provide that.
Thanks so much for that and the work that you've been doing on the front lines. I've seen firsthand, and I definitely appreciate working directly with you. I think the Adabo Family Health Clinic has really shown what community care looks like. I know I had called one day and was like, what about the seniors, you know, not wanting them to have to call or go online to make an appointment, and instantly you're like, all right, Mondays, there you go. And you know, that's what we need right now. We need out of the box thinking in our community to make sure that we are doing what we need to do. So I'm now going to pivot to Elias with my next question. So, you know, we recognize a lot of those frontline jobs, to your point, where you can't necessarily have the privilege of working from home, are often held by people of color, right? Whether it's the CNAs, my mom recently retired as a CNA, if it's the nurses, like my wonderful sorors here, if it's, you know, in terms of hospice care, like Dr. Lawrence, correction officers, law enforcement, all frontline. And so I just wanted you to go in a little bit more in terms of how your members in your union have been affected from this pandemic and what you've seen on the front lines.
Well, first of all, we lost about 6 New York City correction officers to COVID-19. Currently, we have about 1,200 correction officers who are COVID-19 positive. We actually currently have a lawsuit that we're in court next week because we had to, again, force the city of New York and force the Department of Corrections to take care of our members. Right now, correction officers have to come back to work without testing negative. And that's a problem for us. Currently, we have about 364 inmates who are COVID-19 positive. Most people don't know 85% of my members are African American, Latino, or people of color. 50% of my 9,000 members are women. 65% of my members live in the 5 boroughs. We're from the neighborhoods and the communities that we serve. So it had a devastating effect on us. We actually had to, again, I don't mean to be redundant, but it's true. We had to take the city of New York to court just to get testing sites for correction officers. How is it that we had to do that? We actually still fighting for them to open up or create a testing site on Rikers Island. But so far we have forced the city to give us 52 different testing sites with Northwell and a couple of other providers. Right now, we still don't necessarily have, the city of New York is still not necessarily doing what it can do to make this thing easier. In other words, currently we have under 4,000 inmates in our custody. And this is the first time in 30 years that we've had a population that's so low. Right now, we have the ability to change the officer to inmate ratio that will actually lend to social distancing, because we have under 4,000 inmates, but we have close to 15,000 beds just in the jails that we have on Rikers Island alone. So, it's a fight. One of the things that I would like, that I'm pushing as well on the committee that I'm on, is PTSD. I believe that when this thing is over, a lot of my members are going to have problems. A lot of my members still haven't gone home. They still don't go home because they still don't trust that they can go home and not pass this thing on to their family. I have members who've lost their mother and father to this thing and weren't able to have a funeral. I think one of the conversations that need to take place is the discussion about PTSD and the way COVID-19 is going to affect us, is affecting us, and the way it's going to affect us. And again, I say to most people, I'm not just talking about me, I'm talking about the inmates as well, although I don't represent them, but what happens to them happens to us. If they have air conditioning, we have air conditioning. If things are bad, if the conditions are bad for them, trust me, it's bad for us. So those are some of the things that I'm concerned about as far as dealing with this issue, and that's where I am right now. And I honestly think this PTSD thing, we really need to look at it. Not just for the correction officers, but for us in the neighborhoods and in the communities that we come from. Because being locked in for the last 2 months, a lot of our senior citizens, a lot of our older people, a lot of our younger people, there's no way that this is not going to have some type of emotional, psychological effect on us, not being able to go see our loved ones in the hospital and having them die in the hospital. And this is, besides coming to work every day and doing our job, I still have a correction officer that received 16 stitches. I still have a correction officer that got his teeth knocked out. So in addition to trying to continue to patrol the jails and do our job, we have to deal with the COVID, and then we have to deal with a city and an agency that, again, I will say, just not proactive enough. And and having to have to take them to court, and having to have to fight them, and having to have to publicly embarrass them, having to have to go on CNN and Fox News to embarrass these people in order to get them to do what it is that they need to do, which is be proactive. Again, with my commissioner, when she says she didn't have the resources or the staffing, I'm looking at her and I'm saying to myself, like, what is wrong with this woman? You have a $1.4 billion agency that you're running. We have a disaster relief team that we send to other countries, to other states, and you're saying you don't have the resources. Like, we have people in this agency who came from OEM, who came from OSHA, and we know what to do. But the problem is the leadership, and it really seems to trickle down. Not just, it trickled down from the city, and we know what's going on in Washington, but, not to be redundant, that is the effect that it's had on us. And I'm telling you, I'm not saying it because I'm a correction officer, I represent correction officers. I have great love and great aspiration for my members. I really admire my members, because when all of this was going on, they still was coming to work. When we didn't know, when they told us we couldn't wear a mask, then they turned back around and say, you have to wear a mask. It's been so much confusion as to, what this disease is, what it's not, what we have to do, what we don't have to do. But as right now where we are, we're good with the PPEs. I'm sorry, we're good with the PPEs. We had to fight for it. We're just trying to get the city to prepare moving forward for what's coming.
So you gave me space to go one or two ways with the questions, because one of them was wanting to understand what leadership in each of your sectors has done to provide necessary PPEs. But I want to circle back to that, because you raised an important piece in terms of the mental state, the post-traumatic stress, and that's something that I also think about often. One of the past webinars that I did cover domestic violence and child abuse also, because just thinking about being stuck in a confined space and, you know, just the pressures that's coming from this pandemic. So with that being said, I wanted to kick it to Dr. Lawrence and, you know, just someone that is providing spiritual care to those in hospice and where people are physically separated. And in a time such as this, how has it been doing your ministry with this particular population? How has it been providing comfort care where there are a lot of people that are physically separated and passing away alone at this point?
Very, very important question. The issue of mental health is so paramount for all of us. And what has happened now as a result of this virus and the impact on families of being separated, mothers dying in nursing homes and children unable to be there with them, going into the hospital, being totally separated, wives taking their husband to the door, and that's the last time that you see your husband. And then a family member dies and you're not able to have complete burial services to them. So one of the things that we have been utilizing, our MJHS just went on Microsoft Teams. And actually today was my first time going into a nursing home in Long Beach, going to a patient's home, brought my smartphone in for the family member to be able to see their loved one. And this was a Catholic patient. And what's important for Catholics is that they receive what's called last rites as they are ending and approaching death. And this was something that was important to them. So I had a priest call in from another location. I was physically there and then was able to have that family member present. So that gives a sense of comfort and relief that as they now complete their end of life, their journeys, that they have had that. I actually reached out to Imam Musa said to say hello to you, Selvena, to touch base with our Muslim brothers and sisters. I reached out to one of the rabbis, two rabbis actually, to see how it's impacting our communities across the board. And even our own pastor, Reverend Elaine, yesterday in a meeting that we had with the ministerial staff, is saying that one of the greatest things that's so difficult is this lack of congeniality and community. Churches, synagogues, houses of worship has been a place where sometimes, and this is what we have to recognize, that may be the only place that you may be hugged, touched, or kissed for a week. So now we're in an environment where we are separated from one another. So this piece of the post-traumatic stress syndrome, very, very real. And it's something that we definitely need to, in the future, prepare for. I make calls as I'm able to use the telehealth. I make telehealth visits, checking in consistently on the family members, in addition to the patients, if they are able to communicate and talk, singing, providing scripture reading, going back to those hymns of the church that bring them joy. And that's what you want to be able to provide. You want to be able to provide comfort. You want to be able to provide joy. And understanding that in their spiritual walk, as God has said, I will never leave or forsake you, that even though they may be in their home alone, to understand that they are not alone, that they have that divine force that's with them. And then I serve as an ambassador, a representative, and to be able to touch out to family members, to make sure that you are keeping in touch with your family. You know, we had a doctor here in New York, went to visit her family and committed suicide. The impact of this pandemic across the board. So as a member of the community of faith, is being able to really touch people and help them to understand, to utilize your faith, stand on your faith, and stand on your community as much as possible.
Thank you so much for that. Everything everyone is saying, I mean, is really hitting home. Some of the things we really take for granted. Just last weekend, I was able to moderate a Mother's Day event that Senator Comrie held, and Councilmember Adrienne Adams was on there, and hearing, you know, her even talk about like not being able to hold and hug her children to her grandchildren for the first time because of this separation, how hard it was. And then I had to really sit down and think about it, like, wow, I haven't gotten a hug from my own mom since March 1st, which was my birthday. And it's the things that seem so little that, you know, we kind of take for granted. But right now we are at 7:49. I do want to respect time and give folks an opportunity to ask questions. So if you would like to ask a question, please drop it in the chat box. Chantel is going to begin to ask these questions to get responses from the panelists. And I see that 100 Suits is represented here by Kevin Livingston. Hi, Kevin, for joining. He's been also doing some tremendous work in the community, bringing food to the seniors as well. So with that being said, Chantel, can you begin to go through the questions?
Yes. So just give me a second. I just want to go through everything, make sure I didn't finish one. Okay. So this is for each of the panelists. The question is, they said, can we ask about those people who may be carriers? So it seems as if they want to learn more information about those folks that are carriers.
Well, it's hard to tell who are really carriers. They're saying that children are carriers. So you're looking at your children that are school age, and they're thinking that, you know, these children are not really presenting as if they have COVID, but they're presenting with things as rashes and so on and so forth. Me, myself, I was tested for antibodies. I never had any symptoms of COVID, and I came up positive for antibodies. I was never sick or anything like that. They're saying that it's possible that I was exposed, but I never did show symptoms. But when I took my COVID test, I came out negative, which is very interesting. So it could have been a false negative. As far as carriers, they really need to do more research to find out who the carriers are. But I think the carriers, I think it might be the children, because the children are not really getting affected that much. And I will say between ages, we're seeing cases in kids like ages 12 to about 18. You could see these, but those under that age group, like the tweens, we're not seeing too many cases in children. So we're wondering if they are the carriers. But as I said, they still have to do more research to find out who the carriers are.
So I'd like to address that in this manner. I had a household where 3 of us ended up becoming infected with COVID-19. I was asymptomatic. As Joy had mentioned earlier, asked to be tested, but because I was asymptomatic, they did not test me. And I really cannot say how significant that is for us as we move forward, particularly as they begin to open up New York. I was sharing being out in Long Beach today to see so many people walking around, no masks, not social distancing. So I'm asking everybody that's on this call, because Selvena is going out of his way to make sure that we are, said our people perish. And this is true now. Our people perish for a lack of knowledge. So your knowledge is to wear masks, wash your hands, wear gloves. But Joy said, when I come into the house, I change my clothes in the garage. I have a bag. I leave clothes that I'm going to change into in the garage. I have a bag that I put the clothes on in that garage, go into the house. What can go into the washing machine goes into the washing machine. What goes into the dryer goes into the dryer. Today, saw a COVID positive patient. So it's completely wrapped up, okay? I came home, put all of that stuff up and went straight into the shower to wash my hair, wash my body. And that's a routine for every day, every time that you know that you're exposed. When you are fit tested with the N95 mask, you're fit tested because you're tested to see if you can taste this, test that this liquid that goes on. And that liquid is what's going to let you know it's similar how COVID would be in the air. That's why these masks are so vitally important, because that's a point of entry. Your eyes, your nose, your ears, and your mouth are points of entry. So you almost have to assume everyone is positive and act accordingly.
So we have 2 more questions. The next question, if I may, Selvena. Okay. The next question is, have you heard of them extending the wait period? In other words, myself, my sister became sick. She did the whole 14 days, and then she got sick again, right? And her doctor told her to go to the hospital to get labs. When she went to the hospital, they told her, you cannot enter. You have to wait 21 days. It's no longer 14 days. Have you ladies heard of this, or anyone has heard of this?
Okay, well, what I can say is that the CDC has changed their guidelines numerous times. At first, it was if you became symptomatic, you would wait the 14 days. You would go home, quarantine yourself, and then you would have a period of 72 hours that you would monitor your temperature without taking any type of anti-inflammatory medications. If you succeeded and progressed through those 72 hours, you were non-infectious. Then the second series was you go home for 7 days. If you still had onset of symptoms, then you repeated those 7 days again. So as I said earlier, I don't think that the CDC really has definitive enough information to give us a definitive guideline. It's only speculations. With children, Joy referenced children. At first, we thought that children weren't even being affected. And then we heard of a syndrome called Kawasaki, where children were presenting with high temperatures. And then on May 13th, the health department, New York City Health Department disseminated out a health advisory regarding pediatric multi-symptom inflammatory syndrome temporarily associated with COVID-19, interim case definition in New York State. All right, all of that says what? Kids are usually germs anyway. But now this is very, very scary. And it's affecting children that are 21 years and younger. And they're coming up with these rashes. Where are these rashes coming from? So, and to say, I don't think the CDC really knows what they're talking about. We're faced with a COVID monster waiting to attack. And once it does, it's going to devastate you. And it's going to leave devastation throughout its path.
And we still have a lot of research that really has to be done, because right now, with my experience, we having COVID mothers that are pregnant with children. And you know, most of the damage that happens when people are carrying children is during your first trimester. We have our healthcare workers who are working with COVID-19 patients. What are happening to the unborn children at this stage where they're in their first trimester, going into the second trimester in pregnancy? Another study has to be done of that again. You have mothers who are having babies. Mothers and fathers are positive COVID. Okay, so the baby's not with the mother in the hospital, but when it comes time to go home, the baby's going home with the mother. So it's just so much that we have to really learn about COVID and how to handle COVID to keep everybody safe, because it's a lot that we don't know. There's a lot that we don't know, and research has to be done. It
Right.
really has to be done. And policies have to be set in place because we have to know how to take care of patients so that no one is harmed, so that this disease is not spread. And like you said, people today, outside is so nice. I'm going to the supermarket, so many people are masked outside, they're masked inside, but the minute they come out, they're in the parks and they don't have any mask on, so, people really have to adhere to know that they have to wash their hands and they have to wear the PPE. Or else we're just going to end up having more issues.
You're muted.
Thank you so much for that. And just like that, we are out of time. And Joylyn, I hope that you can also make it on the session for next week, where we will have a pediatrician on as well, so we can talk about how COVID is impacting children. As a first-time and new mother, it is something that drives me crazy. I have called even Lenice recently, like, what does this look like? What do you think this is? Because obviously, not knowing what to expect. And, I know everything is changing day by day. 1 minute it was like, only if you are sick should you wear a mask, to your point. Now everyone has to wear a mask. So things are continuing to change, and it's about really informing and educating our community to ensure that we are properly protected. Again, I thank each and every one of you for being here. I pray for you and your colleagues' safety all the time, because, you are doing work that so many people are not strong enough to hold up and do. And to the point that Elias mentioned, that come to work every day knowing the risks that they face. I have a cousin who is a nurse, and she has 2 young boys at home, and just to see her face and how it's impacting her. She has to go through the whole routine every day, washing her hair and all types of steps. And really, like my older sister, most of my family is the medical field, by the way. I kind of went a different way in terms of community, but I just really pray for you, and look forward to continuing the conversation. For those who are watching, next week we will have another webinar, which is the part 2 to this, and really wanting to dig deep in terms of how COVID is impacting our communities. And next week we'll be focused in terms of the children and how it's affecting them, and just wanting to keep the conversation going. How long, I don't know. I actually only started off looking to do 1 or 2, and here we are in number, I think 4 or 5, but as long as I'm able to leverage the relationships that I have to provide information to the community, I will do that. I know people have sent a number of different subjects they would like to see discussed, and will do my best to make that happen. But thank you so much for joining us, and thank you to the panelists. Have a great evening.
Thank you so much. Bye.
Take care.
Bye.
Bye-bye.